Welcome to Baby Basics 2 months. Your baby is starting to show a little bit more personality. Hopefully you are getting a little bit more sleep and you're thinking, maybe, just maybe, I can actually do this parenting thing. The 2-month visit is really important because that's the visit where your baby is going to start to get vaccines. The vaccines protect your child against life-threatening illnesses like whooping cough, pneumonia, meningitis, and even ear infections and diarrhea. Your pediatrician follows a specific vaccine schedule that has been very well researched. You should follow the vaccine schedule as directed by your pediatrician, and your pediatrician is the best source to answer any of your vaccine questions. Growth and development is really important in pediatrics, and like all visits, the 2-month visit will start with measurements: height, weight, and head circumference. Your pediatrician may give you the actual numbers and then also give you something called a percentile. A percentile will compare your baby against other babies of the same age. And while that's interesting, it's really not that important. Whether your baby is a little bit below the 50th percentile, a lot below the 50th percentile, or even at the 99th percentile, that's just where your baby is at that moment. We can't all be average. Some of us will be below average, some of us will be above average. It doesn't really matter as to where they're going to be as an adult. The most important thing is to look at growth from month to month and make sure that that's going in the right direction. So how do you know if your baby is getting enough? Just make sure that your baby leaves over a little bit at each feed. That way you don't have to decide if he or she is getting enough. The baby will figure it out for you. Breastfed babies, usually you'll notice that the amount of time in between a feeding can expand a little bit, and you can actually gently push your baby closer to a 3-hour feed. I wouldn't let any baby go longer than 4 hours from the beginning of one feed to the next feed during the day, because you want them to take their long stretch at night. You will notice that your baby is sleeping more at night, hopefully, going a little bit longer at a time. And that's normal. You can let them sleep through the entire night if they want to. That would be nice for mama, right? During the day, they are awake a little bit more. So after a feed, there may be a time where the baby's looking and playing and smiling, and we'll show that development. So you'll notice that your baby will be awake a little bit more in between feeds. And we'll talk about how to keep your baby occupied. But first, let's go over the physical exam. So physical exam, you'll notice that baby's color is better. Most jaundice is gone. Even breastfeeding jaundice is mostly gone at this age. Baby's eye color may be changing. You may notice that it's getting darker. Most babies are not at their adult color at this point, so the eye color will likely still change. Keep moving him from side to side so that his head doesn't get flat. Remember, no sun for a baby, so no sunscreen, and you just want to protect them whenever they go outside. Your baby's arms and legs and movements are more purposeful, and they may be a little bit less flexed all the time than they were before. So 2-month-olds are getting to be a lot of fun. They're starting to show their personality. They smile, they talk to you.
Do you love tummy time so much?
Sometimes they follow you. The most important thing is to talk to your baby. He's learning how to be social from you. He'll mimic you, he'll respond to you, and he'll just learn about conversation from you. Give your baby special attention. Put your phone away and let your baby know that they're the most important thing in your life. See you at the 3-month exam.